So my name's Dan. I'm a Band 6 in A&E in England. We work very closely with our medical counterparts. You're working in such a stressful environment. I've learned a lot of skills. I've got a lot of transferable skills. We do like a good trauma. You know, they say boys and their toys. Hi Dan, welcome to the channel. Thanks for coming on today. Why don't you tell the audience a little bit about yourself? Hey Dan, thanks for having me on today. So my name's Dan. I'm a Band 6 in A&E in England. I've been doing it for the last 6 years. I've just done my second lot of revalidation. So I went to university. I did my first year at Bristol, and then did my second and third year at Plymouth, and then came out with a 2-1. For those of you who are looking to go to university, no employer really cares, or it doesn't really matter to them what sort of level of degree you've got, as long as you've got a bachelor's degree, you know, and you're able to register with the NMC. Oh, cool. So how exactly did you get into working in A&E then? Yes, that's a really good question, Dan. When I was at university, I had my last but one placement in A&E where I'm working now, and also I did a lot of bank shifts as a healthcare assistant in A&E as well, so I roughly knew what I was getting myself in for, and yeah, it was a big jump when I actually started, but I knew what I was doing roughly. But just word of warning for those of you guys who are at university and looking to work in A&E, there's a lot of A&E departments that don't take on newly qualified. They like you to have a bit of experience, at least a year or 6 months in an acute medical ward, first of all. And have you always worked in A&E, or have you worked in other departments as well? So yeah, Dan, another good question. So I've predominantly worked in A&E since I qualified. I did a 6-month secondment up on the acute medical unit in the hospital I'm working at now. That was a really great experience. It gave me a bit of an insight into the journey that my medical patients would have once they left the department. And it gave me really good underpinning knowledge and understanding of, you know, how our care in A&E actually affects these patients, and how sick patients can get as well once they've left A&E. They've had their initial treatment, but they've gone to the ward, and then again they can deteriorate, and what the different management of the wards have as well. I've also done a few stints on different wards when I've done agency work as well. I've done a few just general medical wards. I've worked on surgical wards as well, but predominantly I am an A&E nurse. So Dan, can you tell the audience, you know, what a day-to-day routine, what's your typical day like working in A&E? So Dan, that's a bit of a difficult question to answer. So there is no typical routine, typical day in A&E, as we get a lot of people in, you know, through our minors area. They're just walk-ins. We get a lot of patients that come in by ambulance as well. It all depends on what's going on outside, determines on how busy and what we get up to in A&E. But your typical sort of routine for patients coming in would be, regardless of whether they come in by ambulance or whether they come in through the front door in our minors area, they walk in, they'll get triaged by one of our staff nurses. They'll have their observations, blood tests, ECGs, cannulas, depending on what their presenting complaint is. And then the nurse then will go ahead and they'll order x-rays, ask for medication, for analgesia, for fluids, for antibiotics from the doctors, speak to them about their patient if they're worried, and then we can escalate then and move them into our different part of the areas of the department. Whether they get escalated to resus, or whether they get de-escalated down to our minors area, or sit in the waiting room. And then, yeah, that's roughly what sort of a basic routine would be. Obviously it varies from patient to patient, because we do get a multitude of different patients that come into the department. So it's about knowing, you know, what's wrong with the patient, how sick can that patient get, how sick is the patient now, and where the best place is to look after them. And what sort of patients do you actually see in A&E? So yeah, Dan, another good question. So A&E, it doesn't stand for anything and everything, but we do get anything and everything through the front door. We can look after patients from when they're 1 minute old. We've had a lot of births in our department recently, so we look after pregnant mums, we look after newly born babies, all the way up to your elderly and your end-of-life care patients. We get medical patients, we get surgical patients, we get gynae patients, we get cardiology patients, neurology patients, anything that someone can have wrong with them, any illness, disease or infection they can have, or any injury they can have, we will deal with it. So in A&E, you're mainly a jack of all trades, master of none. So you need to know a lot about different conditions and different problems, but you don't need to know everything in depth, because our patients will predominantly only stay with us for hopefully 4 hours on the national target, but we are having patients now that are with us a lot longer, like 12, 15 hours, even sometimes up to over 24 hours we've had in the department recently as well. So you do tend to then become like a ward, where you're having to look after these patients a bit longer, but yeah, predominantly we get everything, see anybody. The button there. If you like what you're watching so far, please don't forget to like and subscribe. Leave a comment in the section below about anything you'd like to see in the upcoming videos. Thanks. And what's your favourite thing about working in A&E? Give me 3 or 4 topics. My favourite thing about working in A&E, so I think the biggest thing I really enjoy about A&E is that we work very closely with our medical counterparts. So we all talk to each other and refer to each other on first name basis, which I really like, and I really enjoy that. And I think it brings the team a bit closer together. Because you're working in such a stressful environment, you need to know your colleagues, you need to work very closely with them. And this doesn't go for just the nursing staff, this goes for the cleaners, the porters, all of our support staff. We all work very closely together, and we've all built up quite a good bond with everybody. Another thing that I really enjoy is the skill set that I've developed since I've been in A&E. I've learned a lot of skills, I've got a lot of transferable skills now from working there that I can take across to many other disciplines and many other wards and environments that I could work in. We do plastering, suturing, bloods, cannulation, catheters. I'm one of the nurses in A&E that can ultrasound cannula as well, so that's another good skill set that I've got that I can take forward with me. We also get to see a lot of quite interesting and cool things done in A&E. So I've been involved with countless number of chest drains, we've seen pericardiocentesis, we've had a lot of births, we've had a few thoracotomies, we've had a lot of patients come in cardiac arrest where we've been involved in intubation and resuscitation. We've also had a lot of traumas come into A&E, and I really, I know it sounds a bit bad, but I really do like a good trauma. Again, it's a high stress environment, there's a lot of adrenaline running around. You're working really close, really hard with your colleagues to make this patient feel better and to try and keep them alive, and I really quite enjoy that part. I really do enjoy looking after the more sicker patients. I just find it a bit more interesting. Another one I really enjoy is that we use a lot of different kits and equipment. So from our trauma patients, we've got our intraosseous needles, we've got our pelvic binders, we've got our splints and our traction devices. We've also got our rapid infuser that we use, that if a person is having heavy bleeding, then we can get a lot of fluids into them very quickly. We've also got machines to help people breathe, like our ventilators when they're intubated. We've also got different machines to help them breathe when they're not breathing as well as what they could be, such as our BiPAP and our CPAP and our non-invasive ventilation. So they say boys and their toys, that's the thing that I really like about A&E. And I also like the fact that you learn quite a lot about everything. You've got a general broad understanding of the human body and what can go wrong with it and how to fix it if it does go wrong. And I've had a lot of experience now in A&E that allows me to take that outside hospital. So I've been involved in 1 or 2 out of hospital cardiac arrests, and I've also been recently involved in a person who was found in the sea unconscious after having a seizure, and we dragged him out and I was able to manage the airway until the paramedics arrived. So again, A&E, I really like the fact that I've got a lot of different transferable skills that I can take with me. Hang on, Dan, I said 3 or 4, not the whole spiel. Yeah, sorry Dan, I do get a bit carried away there, sorry about that. So what sort of training courses have you done since working in A&E then, Dan? So the training course I've done in A&E, I've done your normal, your basic life support, your paediatric life support. I've done your intermediate life support and your paediatric intermediate life support. I've also been lucky enough to go on to my advanced life support and my European paediatric advanced life support. I've also recently done my advanced trauma nursing course as well, which is a prerequisite for your advanced trauma life support. A&E is great for developing your skills because you do see a lot of different problems with patients. You need to have, like I said already, you need to have an understanding of what you need to do and what can happen. So A&E is really good that if the courses are available, you will get put on these courses. I've also done my minor injuries and minor illnesses in children, which has put me in good stead then for when I'm going to apply and do my emergency nurse practitioner's course as well. And have you learned a lot since your time in A&E? Yes, as I've said, Dan, I've learned a hell of a lot in A&E. I've got a really good skill set that I'm able to take forward, and I've got a lot of skills then I'm able to transfer out of hospital as well. So yeah, I'd say that I've learned quite a lot in my 6 years since I've been there. Now Dan, can you give us any negatives about working in A&E then? Negatives? I wouldn't really call them negatives. I'd say they're situations that you can find a bit more difficult. So, like I said before, we get everyone from young babies, newborns, up to the elderly and your palliative care patients and end-of-life care patients. So the thing that we do find difficult is that when we get really sick patients in, especially young patients, that don't quite make it, well I say don't quite make it, they don't make it, that can be quite difficult, especially when they're patients that are, roughly your age, they're the age of your children. That can be quite difficult. We have had a few paediatric arrests and paediatric deaths, like your sudden unexpected death in children. They come into the department and that can be quite stressful. And again, you do deal with a lot of deaths. You deal with a lot of old people coming in and dying as well. And again, that can be quite difficult. I wouldn't say that I'm sort of immune to it or I'm used to it. I just develop coping mechanisms now that allow me to overcome the emotional stress and the feelings that I've got and to get on with my day-to-day work. I'd say that's probably the negative. But on the flip side of that, Dan, is that we do have really good debriefing systems in A&E because we do get quite a lot of high stress, high emotional environments and situations that come in. We've developed a system now when, because there's not just yourself, there's going to be at least 3, 4, even 5 people who are involved in these situations with you. And you get to talk through it with them. You get to have a debrief where you figure out what went wrong, if anything, what went well, if we could have or should have done anything different, and if that would have affected the outcome. So this is normally done with a senior doctor that's been involved in that situation, and it's really good to have that feedback. And that will happen almost straight after the event, or at least an hour or 2 later, but no later than that really. And then after a couple of weeks, then you'll have a second debrief when the team and the admin staff can gather all the information that's gone on. The senior consultants then can have a look at the event that's happened, and they can then look at what's gone on, if at all anything could have been done differently, and if it would have affected the outcome. And again, that's really good then because you've had a bit more time to reflect on it. You've had time to overcome the emotional stress that's occurred. But then again, it's really good because then you get a bit more peace of mind. You can, if the patient has survived, you can figure out then how the patient's doing, what their long-term outcome is probably going to be, how their rehabilitation is going. And you don't always get that, but with a lot of patients you can get it. It just depends on where they've gone and sort of the policies that are in place and where they've gone to. Thanks, Dan. That's been really great. Can you give our audience any tips or recommendations if they want to do a career in A&E? So, tips. If you want to work in A&E, I'd say apply. There's no harm in applying. The worst thing that they can say is no. And I would recommend getting at least 6 months of experience on a general medical ward or the acute medical unit first. Because, like I said earlier, a lot of A&E departments, they don't normally take on newly qualifieds, and they do like to have a bit more of experience before they come in. And I'd also say that if you're interested in working in A&E, if you're at university, join the bank, do healthcare assistant shifts in A&E. If you're already qualified and you're working on a ward, again, join the bank, come down to A&E. It's not that scary. We're a really nice team. Every A&E department I've been to so far, the team is great. Like I've said, we all work very closely together. It is a high stress environment. We are grateful for anyone that comes down to help out, whether it be agency staff or bank staff. And just come in, get a feel for it, learn what you can while you're there, and just enjoy it. Subscribe to my channel if you're interested in coming to A&E. That's the biggest thing I'm going to say. I'm going to be giving out loads of information about what it's like to work in A&E, how you can get your best out of A&E, how you can look after the different patients we're going to get. So, yeah, that's probably the only tips I've got, really. If you want to come to work in A&E, just give it a bash. Come on, it's really good, great fun. So there you have it, guys. A really good description of what it's like to work in A&E. Thanks, Dan, for coming on to the show. If you really enjoy what you've seen, guys, please don't forget to like, subscribe. It's going to be really beneficial for the channel and will allow me then to create more content for you guys to look at.